Well, hello everyone. I'm Dr. Paul Fortes, and welcome to another episode of Behind the Scalpel. It's a podcast that I've done now 13, 14 episodes in, and I'm enjoying it. I'm bringing on different people to interview about different topics in aesthetics and aesthetic plastic surgery. And today I have with me Ruth. We were just talking a few minutes ago about when we started working together. It's been over 10 years.
Over 10 years.
And today we're going to talk about NeoGraft. Well, more broadly, we're going to talk about hair loss and what it means, who does it affect, and the options to treat it. So I think it's not, we're going to talk about NeoGraft today, which is a special treatment that you do. We do. We do together. And, patients need to know that it just doesn't begin and end with NeoGraft.
Yeah.
There are other things that can and should be done along the way to maximize
help
the appearance
of
of the hair on your scalp.
Well, thank you for having me, Doc. And we are going to educate the people, your
Yeah.
patients, if they have any more questions. Hair thinning, all the solutions that you offer here, and we can help with any questions, and educate with the hair loss
Right.
and NeoGraft.
Well, we're going to talk about hair loss and whom it happens. It happens to men and women, not just, although it happens a little bit differently. The causes of hair loss, there are some causes that are temporary and some causes that are more ongoing and probably related to genes. And then we're going to talk more in detail about NeoGraft as a solution to hair loss. So common causes of hair loss, genetics is up there. If people are starting to see thinning of their hair, they have to look at their family history to see kind of where they're going.
What's
If they
gonna
have,
happen?
if their dad or older brothers
Uncles.
or uncles are experiencing hair loss and more advanced hair loss, that genetic predisposition for the hair loss is going to affect everyone in that family. So genes is an important one, and nobody can get around genes.
Yeah.
And people often think that it's just from one side of the family and not the other side. It's probably both.
It's both. It's
It's
both.
the-
Lately, it's been research saying it's daddy's side too. So
Right.
yeah.
It's not just mom's side that affects your tendency or a person's tendency to lose their hair. It's both. Hormonal changes can happen, I think, as people get older and the hormone levels change, usually go down, women and in men.
Yes.
That affects the hair.
Mm-hmm.
Women, especially after menopause, when they lose estrogen and they kind of have a stronger influence of male hormones in their body, can experience advancing hair loss. Age, stress.
Yeah.
We talked about stress too as a component of it.
Yeah.
So I think people who can control stress or live
Try.
as a stress-free
Try
a
as
life
We can.
as much as possible. And we talked about hormones, but also hormones like thyroid. When your thyroid gland is out of whack, whether it's hyperactive or hypoactive, if it's too much or too little, that can affect the appearance of the hair.
Yeah.
And then there's other conditions like autoimmune disorders that can actually influence the appearance of
Hair.
the hair on your head. People who have this condition called alopecia areata, that is a specific autoimmune disorder of the immune system attacking the hair follicles, and they can
Exactly.
leave sort of a patchy appearance of the hair on the head. And that's really not something that is treatable with NeoGraft.
Exactly.
It has to be
It has to
targeted,
be treated from the root to be able to
the root cause.
have an option if we can do anything with NeoGraft to replace. If we need to fix it first from within and then see if we can do something
Exactly.
with-
So really finding the underlying cause. If it's a disease, fix the disease or control the disease.
Exactly.
If all the potential identifying medical problems have been identified and corrected, and it's really a genetic predisposition, then that's where
Then that's where
NeoGraft
we
comes
come,
in.
yeah.
What is NeoGraft? You take it from here because
You
you've been
take
doing
it
this for a
from
long
here.
time.
So NeoGraft is a process of a surgical procedure. Very
I would call it
minimal.
minimally invasive.
Minimum invasive, yes.
Yeah.
It's in and out, not literally, but come in the morning, live like 8 hours here. But it's basically this machine here. We have a handpiece with a punch, and if we extract one unit at a time, that unit can have follicles with one follicle in it, or 2, 3, or 4, up to 5. So NeoGraft actually is a individual extraction of the follicle
Right.
unit. So that's more of natural
Exactly.
and less invasive and less painful.
I think in fairness, it's probably, I think, important to sort of go back in history to see kind of how hair loss, all different forms of hair restoration procedures that have come, and a lot of them have gone from moving scalp
scalps.
flaps around. That wasn't a very natural way of doing it.
Plugs.
To, big plugs and it looked like a doll's head. That wasn't natural either. To finally a more refined technique of doing
We
it.
have the strip method as well,
Right.
with the scar in the back of your head, with more
Exactly.
time of pain and discomfort.
Right.
And then we have now.
And the
this.
NeoGraft is the final evolution
That's
of
it.
hair restoration procedures.
That's it.
And this has replaced the strip method by individually harvesting hairs from the donor area, which is the occipital scalp, which is the back of the head. That's the privileged area where those hairs tend to be resistant to being lost. And so that's kind of the fountain of hair for the rest of the scalp
Correct.
where hair loss is occurring.
That's
And so that's kind of the natural evolution of hair restoration. It allows for the treatment to be done with no scar in the back, easier recovery because instead of a cut that's sewn
the
back
suture,
together,
Yeah.
it's tiny little holes that heal very
a week.
quickly.
Maybe less than a week,
Yeah.
but yes.
So I think, this is sort of the standard today. I think.
So.
And we talked about how different it is. We're kind of going back and forth following an outline, but I told Ruth I wanted to have this very conversational. So we're not going to live and die by an outline. But I wanted to refer to it so that we can get all the information out there for people who are watching this podcast. Who are good candidates for NeoGraft? Or who are good candidates for hair restoration with NeoGraft?
I feel like someone with a good understanding.
Expectation?
Yes. We don't want to have.
So if they show up and they
expectation.
almost have no hair at all and they
And
want a
they-
full head of hair, that's unrealistic.
Exactly.
Because as I told you earlier, it's not that we're getting hair from a box on the shelf.
Exactly.
The hairs that we have to use have to come from that person's scalp.
Yes.
And so there's a donor area, which I said was in the back of the scalp, the occipital zone, and those hairs tend to be resistant to loss. And then there's the rest of the scalp where the hair loss occurs. And there's hair loss that happens in men, which is kind of what we call typical male pattern hair loss, where they get the loss in the
recession.
temples and loss in the crown. And then females also experience hair loss, but theirs is a little bit different. They maintain a
We maintain
hairline.
the hairline,
but
we're thin in the back of it.
It gets
a little bit on
thin,
top,
thin
so
throughout. But in both cases, the occipital scalp
it's still
is the donor
resistant.
area.
Yeah. So we have to have good donor to be able to have a good candidate. That's the first role.
You have to match the donor area to the recipient area.
to make
and
sure we
if-
have enough to cover what they want to do.
So I tell patients, they have to be in reasonably good health and that the hair loss has to be mild to moderate, I would say,
Yes.
so that we can restore what's missing and still have enough in the donor area so that that doesn't look thin. I
Exactly.
mean, what's the point of getting all the
Moving
hairs
the hair from another
from the
still have-
occipital scalp if it's going to be left balding?
Exactly.
So it's got to be enough so that there's no sign that any hair is missing to allow restoration of the rest of the scalp.
Exactly. So we want to have a good donor, to be a good candidate
Right.
and just good expectations that we can't give you your 18 when you were 18, hairline.
Exactly.
We want to give you an age appropriate hairline as well.
Absolutely. I 100% agree with that. If someone is in their 50s, they can't expect to have a hairline,
Exactly.
down to here like they're 18 again.
Exactly.
It has to look
Age
like
appropriate.
age appropriate. And I think what's also important is if, in particular in men where they have temporal loss or so much loss that you don't really see a hairline at all, I think restoring the hairline so you can see the frame of the face, that's the key thing.
That's the key.
So even if you're still balding, as long as you have that frame, I think it still looks like you have hair.
Yes, yes. You always, most of our patients that have thinning or have lost their hairline and their crown, we always try to do two surgeries, not at the same time. We have to wait a year, at least a year, to do the second. So the first part that we do, we just want to explain to them, let's frame your face, let's give you a nice hairline, go as far as we can, and then you go wait
And
a
recover.
year. Yes, recover, wait a year and see the length and how you want to comb your hair from now on. And if you want to come back and fill up the next area, or if you're happy with how it looks, then that's it,
Right.
But we always want to start with framing the face.
It's a process.
It's
So
a
it's not you
process.
come, you have the hair, and then you go out
It's a
and
process
and
that takes
everything's
a year.
done.
It takes a year.
It takes a full year, and during that year, things can happen that I have to educate patients about, because if I don't, it's quite anxiety provoking
Yes,
when it happens, and that's the shock loss.
exactly.
And what exactly is the shock loss? People need to know about this. This is important.
So the loss is the shock loss is when we implant the hair. We implant the hair. We put it day of surgery. It stays there within 2 weeks. After 2 weeks, you start seeing the little grafts fall off, and that's when our patients start freaking out. I'm not getting any hair. Everything is just falling off.
And it can all fall out.
Some do, some don't.
Yeah.
It depends also on the patients.
Yeah.
We have patients that don't lose it, and we have patients that lose all of it.
Yeah.
So that is the dormant. So after 2 weeks to 3 weeks, our follicles go into dormant phase, and it's like you never came.
That's a reflection of what naturally happens to all hair follicles. They go through a growth and resting phase. And so the shock comes from the hairs that are transplanted going into a resting phase rather than a growth phase. And so the hair that you see above the scalp, the surface of the scalp, falls away. And you're left as if you had nothing done. However, the big difference is that there is a root
Underneath
that's
in
still
the blood,
alive,
yes.
that is capable of then going back into the growth phase, where the hairs will start sprouting. Like, we hit winter, and then come springtime, the
Exactly.
plants start coming out of the ground, and the hairs after about 3 months start coming out of the scalp, and
Yep.
you can see that. So it's a process that takes about a full year.
Yes, it's 3 months to 4 months. That's when everything starts to grow. It's a process that patients start to get scared after the surgery. It's just
I think if you explain it in those terms, then when it does happen, they're prepared for it.
yes,
Whereas if you don't, they don't know what to make of it.
Exactly.
They think, oh my gosh, this investment of time, energy, and money has gone completely to waste, and that's not so.
Yes, that's exactly.
Okay. Does hair grow back permanently?
Yes, yes. That's because we
After a-
extract
after a
after a
year.
year. That's because we extract from the back of the head where the DHT hormone doesn't affect the hair, and it comes with it. It's just like a combo. It comes with it. So once you implant it and the area that you want to get it, it's just so if you start losing more hair, that's your old hair
Right.
that we need
Not
to
the new hair.
Exactly. So once we start having a consultation with you, the patient has a consultation with you, make sure you explain that they have to have, if they're still thinning, they have to have a hair regimen, minoxidil.
Which is important.
Um,
We kind of jumped right into NeoGraft, but I had mentioned earlier that this is not the beginning and the end. There are other things that I think people who care about the appearance of their hair should be doing and doing every day. And those are things in men using finasteride, which is called Propecia, which is a pill that they take to block the effect of an androgen, of a male hormone that affects the hair loss, that affects the conversion of testosterone to DHT, and DHT is the one that attacks the hair. So if you block it with finasteride, that helps. There are some side effects that men need to know about, but for the most part, it's a well-tolerated
I think
medication.
so. I think it's just like maybe 5% of the patients that I've had throughout the years they've had it,
Yeah.
and once they stop it, it's
And then the other one is minoxidil, which men and women can take. And it's kind of a mystery drug. It first presented as a blood pressure medication, but now it's being used for hair.
That's topical too, so there's options. So if you don't want to take
Right.
anything or just want to do like a topical foam, or there's some oils,
Right.
anything to do to prevent more hair loss is always welcome. PRP, vitamins, anything. We just have to make sure if you're going to decide to do hair transplant and you still are experiencing thinning,
You should do it all.
you should do it as much as you can.
PRP, platelet-rich plasma, or now platelet-rich fibrin. It's basically like fertilizer for your scalp.
Exactly.
So that's another easy, non-invasive way of maintaining the appearance of your hair. And then, nutrients, having good nutrition. If you are starving yourself and not getting proteins
yes.
and all essential amino acids and all that stuff, it's going to affect your body, including the growth of your hair. And there are product supplements like Nutrafol, we were talking about that, that is kind of a blend of different things that help
It's
with
like
hair
yeah,
health.
and it's natural. So we have some people that don't want to take a lot of medication or look into it. Whatever helps to keep the hair that you already have,
You should do.
it's welcome.
And if you're a candidate for NeoGraft, then do NeoGraft because that's kind of like the granddaddy of hair
Exactly.
restoration.
Exactly.
Will it look natural? Will the hair look natural? I think we touched upon it. One of the things that I think with the modern methods of restoring hair is that you guys, when you extract the hairs from the donor area, literally, and this is a very meticulous, lengthy process. You have to have the patience of a saint, which you do, to do it. But you have to go through every little hair and separate out single hair follicles from two hair follicles, three. And you said the most you've seen is 5 and 6 in
Five
one
and six.
family of hair,
Yes, in
of,
one unit.
of follicular units. And so you can't put the 5 or 6 in the front. You have to have the single hair follicles in the front because really a hairline is not a line at all. It's a zone for it to look natural. So you have to have, of the ones, if you look, with a magnifying glass at guys out there at your hair line, and you can see that there are little stray hairs here and there, and those are the ones that have to be put in with single hair follicles so that the hair zone, I'm going to call it the hair
natural. Yeah,
zone,
of course.
looks natural and not look like
Straight.
a straight
It's
line.
a
That
straight
doesn't look
line is
natural at all.
not- Yeah, it's not.
So it can look natural.
We
The re-
will make it look natural.
Absolutely. And the recovery can go pretty smoothly. I usually tell patients, in the first 2 weeks, baby the hair.
Yes.
And
Yes.
and you tell them too, you educate them
Yes.
on their way, once you finish the process. And the process, we didn't talk about the process. It's kind of a two-stage process. We mark the scalp. Patient comes in usually at the crack of dawn, 6:37,
Yes.
because we have to get
We
started.
have to start early.
It's a long process, because often we are transplanting up to 3,500
Yes.
hairs, and that takes almost all day to do. And the first part is the harvesting phase. So they usually get a Valium or something to relax them. It's done, you're completely awake for it,
Completely awake but relaxed.
but relaxed. They're usually on their belly. Back of the scalp, the donor area is literally like not shaved, but almost military haircut. It's like down to stubble length.
Zero. Yes.
You have to have that in order to get the hair follicles because you can't have full length
We
hair.
can't. No, we don't. We're not able to see the way the hair grow. So we want to make sure once the back of your head is shaved, we are able to see the angles, and we can go in and we don't transect. If we do have long hair, it's more transect.
So it
We don't
requires
get
a
the-
skill in order to do it right,
Yes.
which you guys have.
Yes.
So that part of the procedure may take 2 hours or
It
longer.
takes 2 hours. It takes about
Yeah.
2 hours, but that's when the patient is very relaxed, taking a nap, listening to some music, and
And it's done under local anesthesia,
It's
so you
done,
inject
yes.
a mixture of lidocaine,
Lidocaine.
and then they don't feel any pain at all. They may feel a little bit of pressure, but that's it.
Exactly.
And most of the time, they kind of fall asleep
most of the time they do. Most of the time they
when
do.
they're belly down. And then there's usually a break in the middle of the day for lunch or a snack. And then the second half of the day is showtime. It's
the implantation.
they move from a belly down position on the bed to a sitting up position and literally numb up the recipient area, and which has been already marked. And then you tell us how that goes.
So the second part is the part for the patient is most of the time is
More awake.
awake and favorite because they're now on their back. It's more comfortable. They can be on their phone. They can be watching TV, doing
Usually there's a TV in the
computer,
room.
computer work, whatever. We recommend not to do any work because you're on medication, but some patients, like to read their emails. But it's more comfortable, and that's when showtime happens. That's when both of us. The extraction part, it's only one person. Someone's extracting.
It's hard to do that with two
with
people in there.
Yeah, we're on each
Because
other's
it's
way.
literally like a very small area.
Exactly.
And so it's just a one-man operation to do that.
So the other person is counting and separating. So it has to be
You
a
help each other.
teamwork. Yes. So but the second part, we both of us are placing. One's on the left and one's on the right, and
Yeah.
we're just going.
And in order, again, to keep things natural, it's not just placing the single hair follicles in the front of the hair zone, but also paying attention to how the hair naturally grows, how it doesn't come straight off, it can come at an angle. And so you have to pay attention to how the hairs come out of the scalp.
We follow the way the hair grows. We
Yeah.
follow the patient has a calic. We follow that. Patient has this side growing this way. It's just we follow the way of your hair, so we make it look natural as possible.
Right, so when you make the little tiny incision, it follows the angle of the natural hair that lives in that zone of the scalp. And then literally, it's kind of a tedious process because again, 3,500 implantable follicles, and you're doing it each one by hand. It's not automated. Literally, you have to do each one individually. So it takes a while. And usually by the late afternoon is when things are wrapping up.
Yes. If everything goes good with numbing and everything, yes, we have maybe 4 o'clock, 4:30 on a good
Right.
patient.
So expect, 6:30 in the morning to late afternoon, 4:30.
Yeah, up to 5 sometimes.
We didn't talk about this, but can women get NeoGraft too?
Yes. We've had
I almost see as many women as I do men.
more in the couple of
Really?
years. We have more women finding out and being able to do it. The only thing with women though is the shaving part. Some people, I have short hair, so in my case, if I need to do like a big case of 2,500 or more, I have to shave the back of my head. Okay, if I need to do
That's a key thing.
1,000 to 15, maybe 18, I can part the hair, give it a ponytail, and just shave maybe 3 to 4 fingers, and then be able to put it in a ponytail so we can
So it covers it
hide
up like a curtain.
the shaving part.
Yeah.
But if we're gonna do a big case,
But if they their hairstyle is short, that's not really an option.
that's not an option. Yeah.
So they have to
we have to
understand.
have medium hair to long in order for us to be able to hide it.
Yeah.
And honestly, for ladies, we recommend doing like small areas at a time. Some ladies have a big gap, like from here to here, and then wide. So we recommend focusing on half of it first, let it heal, let us shave again later on, and do it again.
That way the recovery is a little bit
We can
more
only
tolerated.
get so much from the shaving part from
Right.
ladies. With ladies, we try to be more conservative, hide it, give them better look of.
So probably in those situations, if you know you're going to be back to do more, maybe limit it to 1 to 2,000 per treatment rather than go for
the big,
3,500,
exactly.
which is more typical for men.
Yes. We do eyebrows too for ladies.
Yeah, mention that because that's another interest. Ladies are always, wanting if they're recovering from what they used to do in the 70s and 80s where they tweeze the heck out of their eyebrows and now they basically have like nothing and they're kind of exhausted microblading and they want natural brows. I mean, there's NeoGraft is an option for them too.
Yes. It's that's more. We can hide that area because we only shave maybe 2 fingers in the back of your head, whether you have short hair or not. Because we only get up to maybe 600 grafts, but we split those.
So 3 and 3?
If that's all they need. Sometimes we need 1,000. So, but that little strip is going to get us what we need because we actually have to cut and trim the follicles. We can use 2s and 3s on the eyebrow. So most of them are singles.
Yeah, if
We
you
get what
pay
we need.
attention to what the
Yes.
brows look like, they don't have clusters.
Exactly. So we
3 or
we
4
make
hairs.
it look natural as possible. We give you a nice shape, the shape that the lady wants, and even men sometimes they do have some gaps that we need to
Right.
do. And
Kind of moth-eaten eyebrows.
yeah, we
I have
if we are gonna do
I have a little bit of that
eyebrows,
too.
you have to keep them trimmed all the time. We've had patients they don't do anything and they look so very
Like Brezhnev.
crazy. So we want to make sure we always tell the patient, you're going to do eyebrows after a month or 2 that you see the growth. It's going to look a little wild because of the thickness of the hair in the back to your eyebrows, but always keep it. Cut them all the time because they're going to grow long. no matter what. They're gonna grow
'Cause
long
they're
because
used to
they're coming
growing long.
from exactly. So keep them trim and keep them nice.
Keep them neat and trim.
Yes.
You know, you told a story about a friend that had the NeoGraft treatment, how that experience was for him. I mean, it's really a confidence boost, I think.
My
If people
goodness.
sort of are concerned about, the appearance of their scalp and losing hair, especially maybe at an early age, and then not wanting to leave the house without a baseball cap or something to conceal it. I mean, this is a game changer for them. It really and makes the difference between feeling confident and feeling happy or feeling depressed and anxious.
Exactly. So my friend actually a year ago, we started, he said, let's do it. I'm tired, let's do it. I met up with him. I said, show me your hairline. What do you want to do? Just talk a little bit to see what the expectations were from him.
Right.
He's, I think he's 40, 41. He told me, I said, it's done. We can do it. So we did it. He did PRP after that. And let me tell you, it's just, he's not wearing hats anymore, only when he's at the OR. But
He's on social media all the
he's on
time.
social media taking pictures
He's
with the
proud
baby
of his
girl.
hair now.
Yes. And I take a lot of pride on that too.
I know. I mean, the results were great, and
So-
I think most I think have been success stories.
Yeah.
I know. What's the survival rate of transplanted hairs? It's pretty high.
When following the instructions and the post-op instructions, it's 95 to 97.
I mean,
rate.
that's
It's up there.
amazing. That is excellent.
When it's not followed, it's not good. So always bring someone, if you decide to do NeoGraft, always bring someone with you to follow or to listen to the instructions that we're going to give them, because we want to have two people listening. One on medication
Right.
and one that's not on
Right.
medication.
I think
So,
that's important for anything
Yeah.
in plastic surgery. Following instructions for the best results.
exactly. We can only give you what you came for and give you the instructions, and after that, that's
And once you're past that critical first 2 weeks where you have to really baby your hair, we go over that with patients so that they know exactly what to do, what not to do. Then they're pretty close to going back to normal life. And then doing all those other things to preserve their hair. Whether it's minoxidil or finasteride or Nutrafol or PRP, all those things. I
so
think
after they leave, we'll give them options. This is what, and we'll tell you, hey, you might want to. Some people come, they're not going to lose any more hair, and we know. So when you're here, we'll let you know. You know what? You need to start doing something because you're gonna have more hair loss. We can see it. So this is the options that we're giving you. And
Yeah.
some people, after this, you're good. You don't need any more. So we'll let you know at the day of, surgery, and we'll give you the options. Now that's not gonna be up to you to follow the recommendations that we're giving you for better results for your
Right.
own hair and the transplant hair.
Right, exactly. And I'd like to say that this is a one and done, but I mean, actually, people can come back, and you've had patients who have been back 4 times
4 times.
for NeoGraft.
Not because they're
Not
not,
because it's-
happy, but because they won the result. They like the
Yeah.
result that they will keep wanting more.
And time has passed, and they've had progression of
And
their
they
hair
are,
loss,
yes.
which is expected, and they want to keep it up.
Yeah.
Maintain it. And as long as there is a donor area that
We can
can meet those demands, then it's possible
First
to
time,
do.
yes. Second time, yes. Always consultation with you before,
Yeah.
anything. But after the second time, you have to make sure they have a good donor so we can extract and know what they want. If they want to lower the hairline, we'll take a look at it.
Right.
But if they have hair to keep filling in to make it thicker, that's always an option too.
Exactly. So it actually can be a lifelong
It is.
option for patients. They start off maybe early, and with each passing decade,
Especially
maybe
with
do
young
a
people,
refresh.
yes.
And you said it doesn't have to be the big 3,500. It could be just tweaking it so that you get a little bit more.
Yes. A good maintenance is good too.
A maintenance, plus all the other stuff.
Yeah, of course. Following recommendations and, it's always good.
Well, great. Well, I mean, I love talking to you. You're such a fountain of information, and you've been doing this for such a long time. And we've worked together for a long time too. And I hope to continue working with you
Yeah,
because
I'll be here.
this is fun. It's always fun. And this is the first time we've actually chatted in front of the cameras
Yeah,
about this.
yeah.
Why did it take so long?
I'm just shy.
Well, you did great.
Thank you.
You did great. So, you guys can learn more about NeoGraft by going onto my website, fortesmd.com. And there's information there about NeoGraft. And you can also book a consultation with me by calling the office and asking for an appointment to see me about NeoGraft. And that's an easy number. It's 713-799-9999. And my guess is that this may also be on social media somewhere, and so you can find me there and find Ruth there. And if you're interested in NeoGraft as a option for hair restoration, whether you're a young person or an older person, whether you are a man or a woman,
Exactly.
I mean, there are many people who this is an option for them.
And I do want to say something before we finish. I do want patients to do their research. You know, I've been doing this for 15 years, and most of the patients said, I went on YouTube and I saw the videos. If that's going to make you feel safe, if that's going to make you feel more comfortable,
Hmm.
do whatever you have to do. Do your research, read, go on TikTok, or whatever you want to do it. But just know that the day that you get here, you have a very professional team that's going to hold your hand throughout the process. Starting in the morning, drawing the hairline. We're not going to stop until you're happy with the hairline. We're not going to start until you're relaxed and you're comfortable enough to like start the procedure. We're going to anything that you feel uncomfortable or anything, you have a great doctor and a team that's been doing it for more collectively with my coworker, it's been more than 18 years together. So
That's important.
just know that you're in good hands and you have a very knowledgeable team, behind you throughout the process and after the process too. So
Experience, expertise.
so do whatever makes you feel good, like research, YouTube. It doesn't matter. It's going to be your experience at the end of the day.
Exactly, exactly. Well, this has been fun,
So, I know.
Ruth. We ought to do it again and sort of touch up on, new things.
Yeah.
Because there's always new things that are developing in hair restoration. So, guys, it's been a pleasure, and I look forward to the next podcast. And from now, you guys have a fantastic day. Bye-bye.